New funding will soon help the state of Wisconsin increase its efforts to prevent suicide. Today, DHS announced that it secured a 5-year grant from the CDC. CBS 58's Adam Reif explains how advocates say it's going to help save lives.
Well, the grant totals about $900,000, and DHS says the money will be used to reduce deaths in areas of the state that have the highest rates of suicide. Advocates and survivors say prevention measures work.
I see their struggle and I see my former self in them.
Marissa Baylarian has come out the other side 5 years ago after struggling with several issues in her life. She says she had suicidal ideations and hit rock bottom. Her mother called the suicide hotline the first step on a road to healing.
After that phone call with the suicide hotline, these steps, they were small steps, but they were monumental steps toward my healing.
More resources will soon be available throughout Wisconsin, thanks to a grant from the CDC for more than $868,000. Suicide prevention experts say it'll go a long way.
Increase access to care. So for individuals to know where they can go to receive the right care at the right time.
Firstly, they say the money can help scale up existing resources.
We really want to make sure that people are aware that they can talk about these things, and there's a good chance that we can provide support.
And secondly, it can help build resources that are currently lacking, like more culturally competent care.
There's been a growing number of individuals within the BIPOC community that have had increased rates of suicide attempts as well as deaths by suicide.
And it's needed now more than ever. Suicide increased by 32% in Wisconsin over the past 20 years. It's now the 10th leading cause of death in the state.
Mental health has only gotten harder and worse, I would say, throughout this pandemic.
But experts also say there is an increased willingness to talk about suicide. And there is much more flexibility for treatment with online therapy and telehealth resources. It's partly why Marissa is hopeful when she sees some of her past self in people currently struggling.
I know that there is hope for them, and so the more that we're talking about it, the more that I think that they're going to be feeling okay to reach out.
And suicide prevention is an ever-evolving field. Just in the past month, 16th Street says all 65 of its providers went through extensive training to learn new prevention measures. For anyone in Wisconsin who may need help, dial that lifeline at 988. In Milwaukee, Adam Reif, CBS 58 News.